All right. Hi, everyone, and welcome to our podcast show brought to you by the Students Against COVID. The Students Against COVID is a global grassroots movement of more than 200 students from 50 plus countries that aims to bring together students and allies across the globe to create a common platform, sharing ideas and brainstorming together and really helping to create a difference in combating this crisis. My name is Asma Ladak, and I'm here with my co-host Liana from Germany. Today, we have a special theme for this episode, which is mental health. And apart from the debilitating effects of this virus itself on our physical health, this whole pandemic has also had the potential to adversely affect one's mental health, either directly as a consequence of contracting the virus or because of the global lockdown. So joining us today all the way from Dubai, UAE, is an esteemed psychiatrist and mental health expert, Dr. Meshal Sultan. Dr. Sultan is a consultant child and adolescent psychiatrist at the Jalila Children's and assistant professor at Mohammed bin Rashid University of Medicine and Health Sciences, Dubai. He is an international fellow of the American Psychiatric Association and a fellow of the Royal College of Physicians of Canada. Dr. Sultan has also published in peer-reviewed journals and presented in international conferences on several topics, including ADHD, collaborative care, and mindfulness. He is currently the clinical lead of the Mental Health Intake Program and the Deputy Director of Academic Affairs at Al Jalila Children's. He also serves as the General Secretary of the Emirates Society for Child and Adolescent Mental Health since being elected in 2018. So thank you so much, Dr. Sultan, for joining us. Just reading through your introduction, I myself was so overwhelmed that, we've probably chosen the right person to talk about this topic. It's truly an honor to have you, and thank you for volunteering your valuable time to the show. So without further ado, let me just dive into, setting the stage for this conversation this evening. Perhaps if you could start off by talking about what sort of mental health effects has the lockdown or the coronavirus itself had on the global population, and to what extent do you see these mental health issues persisting even after the pandemic is over?
Thank you so much, Asma and Liana, for having me, and thank you for the kind introduction. I'm really delighted to be with you today, and I'm really happy that you're raising important questions, especially that mental health is part of general health. And definitely this period is exceptional, and all of us are going through some form of stress in the context of this pandemic, as well as in the context of the lockdown. So a lot of emotions can be associated with this stressful period, including feelings of anxiety, depression, loneliness. And we need to be more vigilant about the impact of the pandemic on vulnerable people. In addition, we also need to be mindful about the impact of the pandemic on healthcare providers, since they go through a lot of stress given the nature of their work, as well as they may have a lot of fears. For instance, the fear of getting the virus while at work, as well as they may have some feelings of guilt in the unfortunate circumstance if they do get the virus and pass it to one of their family members. So it's really important to bear in mind that healthcare providers are at an increased risk of developing mental health conditions, especially during this period, as well as other individuals who have pre-existing mental health disorders. Because research looking into rates of mental health and worsening of symptoms and previous pandemics has actually shown that individuals who have mental disorders at baseline are at an increased risk of developing relapse. So it's really important to bear these populations in mind, as well as the elderly, in addition to children and adolescents. In addition to the mental health impact of the condition and the psychological effect, there has been a lot of effects, including the financial consequences of the changes in the routine and so on. So definitely hopefully once things are back to normal and resolved, people will need some time to go back on track.
Thank you very much. Our next question would be about the strategies that we could use to overcome these difficulties, and how could the mindfulness be used as one of the tools?
Thank you so much, Liana. I think it's quite important to pay attention to the changes in routine that has occurred. And some of us may find it quite challenging to know what day of the week it is. since we have a lot of things have changed, right? We used to, for instance, have a regular routine in our day where we would wake up in the morning, we'll get ready for work, and then we'll go to work, and we'll spend some time at work, and then go back home, and so on. And these transitions actually have a positive impact on our psychological health, since we do have a lot of things to do, and we have a structure during our day. So when the structure is interrupted, it is expected for people to feel quite distressed, especially a certain population, which I can elaborate on later on. However, it's quite important to remember the key elements that helps in maintaining psychological well-being. So mindfulness is one strategy to help us cope with stress, for sure. However, even before thinking about practicing mindfulness, it's really important to think about self-care, how we can take care of ourselves at a physical level, because as you know, physical health is related to mental health and psychological health, right? So this would include getting adequate sleep, for instance, adequate hours of sleep. So speaking about adults, for instance, the average range would be 7 to 9 hours for adults, right? Children and adolescents require longer periods. It's important to eat healthy, to exercise regularly. It's extremely important to be kind to ourselves, especially during these periods, because we may feel quite overwhelmed, we may feel helpless, right? And we may develop a lot of negative emotions. So it's extremely important to be kind to ourselves, and also to maintain our connections with others. And we're living in an era where there is technology which allows us to get connected. So now, even though each one of us is in a different, region, however, we're all here together. So it's really important to remember the basics of maintaining psychological well-being. And mindfulness has a huge role in helping us actually be at sort of focus at the present moment, rather than get overwhelmed with worries from the past or worries about the future, which can have a further negative effect on our psychological well-being. And what is quite neat and interesting about mindfulness is that it can be practiced at any moment and time. It can be practiced either during our day-to-day activities where we can be mindful, and people can also practice mindfulness through mindfulness meditation activities. And I can elaborate further on this if you wish, including me being with you at present. I'm doing my best to be focused, right? And attentive to whatever you're going to ask me. And I'm trying to regulate any memories that may come from my day, right? Or any worries that I may have from the future, given that I work in a stressful job. And this applies to everyone. All of us have their own stresses. So mindfulness actually helps us a lot in connecting to the people who we live with, for instance, as well as enjoying the activities that we are doing by being fully present. And this has a significant positive impact on our psychological well-being.
And a kind of a follow-up question, are those the same strategies that could be used by the vulnerable population?
Definitely, mindfulness can be used by anyone, right? As well as maintaining a healthy lifestyle, it can be used by anyone. It's the foundation for psychological well-being. What is also quite important for the vulnerable population, and I mean by that the individuals who have pre-existing mental disorders, they may go through a lot actually, uncertainty, fears about the worries about the future, as well as a lot of them will have the worry of, are we still able to access services as we used to in the past? That's why this population in particular would require a lot of support, a lot of education. We need to remind them about the importance of connecting with their healthcare providers and getting guidance and support, especially during this period. And even if they felt lonely, and even if they felt that it's quite hard for them to access, it's really important to support them in getting the access. And luckily with technology, individuals can get in touch with healthcare providers, and a lot of services have been providing support through virtual clinics, for instance. So it's key to remind them about the importance of getting connected to the services, as well as utilizing the basics of maintaining psychological well-being.
Thank you so much, Dr. Sultan. So since you spoke about, virtual clinics, I'd like to sort of connect my next question to that and really bring the focus to low and middle income countries. As to, we've seen that because people have started using mental health services more than they were before the lockdown, there has been a huge burden on, the fragile mental health system, especially in low middle income countries, let alone the high income countries. So, what can institutions and governments do to be proactive about the mental health of the population? And, what advice would you give to the LMICs keeping the resource limited settings?
So paying attention to mental health is extremely important. And there's a lot of research highlighting how prevalent mental health conditions are and the impact of mental health conditions on productivity. So it's extremely important for, policymakers to pay attention to this. The helpful thing actually and hopeful at the same time is that the World Health Organization, WHO, has been investing a lot in providing resources as well as self-help booklets and so on. For instance, last week, they've published a very helpful resource, which is available for everyone. So now it's published in English. And they also mentioned that in the upcoming days, they'll publish in several languages, which will help and allow people to make use of this resource. This resource is called Doing What Matters at Time of Stress, or Doing What Matters at Stressful Times. And it's written in a very easy way, using a lot of illustrations. It's basically all pictures. And it walks you through an interesting and engaging scenario of how to cope during these stressful periods. And it's targeted to individuals at different levels. And it's quite neat because it actually speaks about several steps that people can apply and implement in order for them to get the support that they would need. So I'll encourage everyone actually to utilize this service and to download the booklet and go through it. So it speaks about how we can get stuck in certain negative emotions and what we can do actually to unhook ourselves from these emotions and be focused at the present moment. It also highlights the importance of values, how individuals can identify their values, and even if they had any negative emotions that may distract them, get them move away from their values, it's helpful for them to know that they can do a lot of acts of kindness that can help them connect to their values. For instance, all of us are in the medical field, and even if some of us felt that they're detached from their day-to-day work, right? They can identify, and we can identify our values and say, we know that the value of caring is really important, right? And then we can think about practical ways and acts of kindness that we can do in order for us to fulfill this value. And research has shown that people who fulfill their values, they have a more satisfactory and more fulfilling life. So this is just a nutshell about the booklet. So I'll encourage everyone actually to utilize these online resources that can be very supportive.
Even though we have a lot of these resources online and not only, there is a little bit of a neglect in investing in mental health. Is there a message that you want to send about how could governments and institutions help and mitigate the situations in the future? Like, how could we help?
So we're all advocates for mental health. Advocacy is definitely key. So I'm not a political person, so I don't know how the politicians actually think, and it depends on the country. However, a lot of countries value caring. A lot of countries value giving. A lot of countries value supporting each other. So you can definitely advocate on the importance of these values and supporting individuals who require the help and support. It's really important for us to spread awareness and also advocate for not stigmatizing the individuals who struggle with mental health conditions. At the end of the day, any individual, regardless of race, ethnicity, background, are at risk of developing one form or another of a mental disorder. So it's really important to appreciate that at the end of the day, we all belong to this universe, and we all contribute in one way or the other, and we're here to support each other. Also, emphasizing on the importance of compassion can have a huge role in having people be more motivated to work towards being compassionate, supportive, and helpful to everyone.
Thank you very much. Is there a concluding remark that you would like to give us?
So at this time, it's really, really, really important to pay attention to our mental health. It's really important to be able to identify any thoughts and emotions that we have. It's really important to be able to label them. It's really important to know that emotions are not our identity. We have our personality and identity. Emotions can come and go. However, it's quite important for us to live with the emotion and to see what does it mean and cope with it, and appreciate that this period is going to pass. So it's a difficult period for sure. It's going to pass. And we will learn a lot from this period. We will learn the importance of establishing connections with people who we care for. We would learn the importance of being compassionate to others and being compassionate to ourselves as well.
Thank you very much. So at the end, as the coronavirus pandemic continues, billions of people across the world are struggling to comprehend and respond to the far-reaching ramifications of the coronavirus. Increased social isolation and anxiety and economic downturn are a perfect storm to have a profound impact on people's mental health and well-being. We must care for not only our bodies, but also our emotions and thoughts. Be kind to yourself and others. Try to stay positive and use this time to try things you've been putting off, such as learning a new skill or getting in touch with your creative side. So this episode with Dr. Sultan, thank you very much again for your time, has been truly an insightful one. So as in the name of the Students Against COVID and my colleague, we once again thank you, and we hope that you will do your work, continue doing your amazing work, and we hope to see you again. Thank you.
My pleasure. And have a good night.
Thank you so much.
Thank
Good
you.
night.
Thank you, Asma and Diana. Take care.